We've come together for this year's conference for the 5th year in a row. The topic of this year's conference was precision medicine, from molecular mechanisms to targeted therapies. And we've been organizing this year's conference together with the University of Pittsburgh Medical Center. Mark and I originally started the Munich-Pittsburgh Lung Conference, and Mark has been a very close friend and close collaborator in the field of pulmonary vascular diseases in the past. One of the conference highlights was the address of the NIH, which has been given by Jim Kiley, the branch chief of the NHLBI, who addressed the Precision Medicine Initiative, which has been initiated by the NIH this year. Another highlight was the address of the BfArM, which has been given by Julia Stingel, the vice president of the BfArM, who addressed regulatory aspects of precision medicine. That is the question, are we able to afford precision medicine in future years for every patient? The Helmholtz Zentrum München benefits from the conference because we've been able to put this conference on the world's map. Also, a conference such as the Munich-Pittsburgh Lung Conference attracts researchers from across the world to Munich and to our center. It gives them the possibility to apply for fellowships after they've visited Munich during the conference and come back for research collaborations, which many of them do. Leading experts in the topic of the conference come to our city and present their data, sometimes unpublished data. Second, we bring together junior scientists and senior scientists alike and give them the possibility to be mentored and mentor in a very close and interactive fashion. The topics of the conference are covered in a very interdisciplinary fashion, bringing together multiple disciplines, not just medicine, but also this year, for example, systems biology, to interact and actually benefit from each other's expertise. We not only bring leading scientists, but also bring journal editors to the conference who discuss publication ethics, publication policies performed by the leading journals in our field. The people have to feel safe to talk about unpublished data, and that is enabled by very close friendship and mutual respect for each other. We had a choir performance by the CPC choir, which performed on stage songs for the very first time. Precision medicine and enabling precision medicine is probably the most important topic in medicine, in greater medicine of today. That is why the conference has already stimulated a number of collaborations in the field of precision medicine. The foundation and the establishment of the DZL has really led to worldwide recognition of the initiative of respiratory medicine in Germany. One major address of this year's conference was given by Professor Werner Seeger, who is the current chairman of the DZL. Günter West, the CEO of the Helmholtz Zentrum München, has been a major supporter of lung research in the past years. He has been a driving force of the establishment of the Comprehensive Pulmonology Center in Munich. Every year, we are also able to award the best presentations via generous donation of the Münchner Bank and the Stiftung Atemweg. This year's recipients, Charlie Lay and Bill Chen from the University of Pittsburgh Medical Center, presented superb approaches of precision medicine at the conference. The two best posters were also awarded at this year's conference, and these prizes went to Joshua Redder from the University of Pittsburgh Medical Center and Gerrit Jones-Schuster from the CPC. For the next conferences, I have several expectations if you so want. One is that we maintain and even further the enthusiasm that the conference has built on a world scene. Second, that we've continuously been able, or that we will continuously create the novel topics in respiratory medicine. A great expectation would be that the collaborations that originate from the conference will lead to novel therapies or novel diagnostic regimen in chronic lung disease.